Welcome to Beneath the Branches, the podcast for the adoption and foster care clinic where we sit in the shade of shared experience. The heart is normalized and belonging is built one honest conversation at a time. Adoption, foster care, or kinship placement brings deep joy and real challenges, and we're here to talk about all of it. The hard, the heartwarming, and everything in between. So grab a cup of coffee, take a deep breath, and join us as we hold space for the messy, beautiful work of building connection beneath the branches.
Welcome back to the Adoption and Foster Care Clinic podcast. Today we're going to talk about attachment, which is a big subject. So we're going to put out the disclaimer that we're just going to scratch the surface. There's so much under this category, but we thought we at least need to touch on it. And then we can go into different things later and different layers of depth. But we'll start today with Kelly and Caitlin helping me kind of define it and what are the main key points that we need to talk about when we're trying to scratch the surface and introduce this topic.
So I think first is like, what is attachment? You know?
Yeah, which is like, there's so many, I think so many different ways you can define it. In its simplest form, I think attachment is the safety net we create in relationship. You know, like it is our security. You know, like just to attach to something, there is a connection that's implied. So, and for the human population, attachment is those key relationships, you know, like that kind of lay our foundation. Everything builds on top of attachment. And it is pervasive in the way that it connects to all of our other relationships and how we show up in the world.
Like our secure base. Like it's our base.
Yes, it's our base.
Of which we can go out and experience the world from.
That's right. It should be secure. You know, hopefully it is secure. What comes to your mind?
Yeah, I think that, and I think that, you know, just distinguishing between like bonding and attachment, you know, like in my mind, bonding is kind of like that initial connection that, you know, a baby or a child feels with their parent. Attachment is kind of the bigger one.
Yeah, like the maturity of.
And the maturity of
bonding.
Of that bond,
Yeah.
you know.
Yeah, and then there's also trauma bonds.
Yeah.
Which are not attachment.
Right.
So what's a trauma bond?
A trauma bond is when in a big moment, a traumatic moment, a child or person, I guess you know, could trauma bond to a peer, could trauma bond to another peer, but you basically like cling to create safety for yourself in the moment. And that is not necessarily a stable relationship, but it's like a survival mechanism of I'm in a traumatic place. I need stability. So I will create this strong bond to this person that's with me in this.
So which happens at adoption because that is a traumatic experience, but it can turn into a stable attachment.
Yeah.
Right. If parents are responsive, you know, and utilize, you know, that experience in a really positive way, it can, for sure. We see it all the time with families who are just getting home with their kiddos, you know, and parents will unknowingly believe that it's attachment because it kind of looks like attachment. You know, the child will seek them out for support. Like they'll be really clingy.
They'll cry when they walk away.
Right, they'll cry when they walk away. But really it's a trauma bond versus true attachment. So
yeah. Let's talk through, I guess, when attachment goes wrong. Like, what does it look like? I know we've talked a lot, you know, you see a lot of different types of attachment listed. And so there's your secure attachment. Then there's your insecure types. So how did attachment theory come about?
Okay, so attachment theory. My first introduction was this baby college student in like one of my very first social work 101 classes when you go over like all of the psychosocial theories and the foundations. And that's when I was introduced to John Bowlby, who is the father of the attachment theory. And his story stuck out to me at that time because he was a father and his child had a nanny, and he was watching this caregiver dynamic. And a part of his story was as he was seeking attachment with his own child and watching her develop it with this nanny and this caregiver who was responsive and consistent, it was like he was aware of his own inability to attach, and he saw this deficit in himself, but was watching it kind of happen in front of him. And so he developed the attachment theory from that. And that was always so sad to me, just to be fully aware of the elements of attachment and the security it created, but then unable to replicate it in your own relationships.
And I think what people have usually heard kind of the basics of the attachment cycle. Can y'all kind of quickly go through what is the attachment cycle?
I mean, to me, it like in a really simplistic form is just really responsive parenting, you know? So it starts, you know, hopefully when, you know, the child's a baby and the baby cries and the parent immediately meets that child's need. And so that child has its needs met. And so that child is able to like co-regulate. And then the baby cries again. And then the parent is super responsive and immediately meets that need again.
And there's consistency involved in that too. Like it's a consistent caregiver that responds.
And a safe caregiver, not a scary caregiver, but a safe, responsive, nurturing caregiver who responds to those needs every single time over hundreds of interactions. And in a perfect world, that's the baseline. That is, you know, how children start to begin to develop attachment. And again, in a perfect world, like in a typical like child development scenario, you know, true attachment really starts to form somewhere between, I always say 6 to 18 months, because there's like so much variation during that time. But again, by 6-7 months, a responsive parent and that baby have had hundreds, if not thousands, of these positive interactions. So that's when attachment really starts to form. And so many of our kids that we work with, they've never had that, you know.
And what would you call those first, like birth to 6 months then? So how would you categorize that time? You know, because those, like that's, you're creating the building blocks, right? So like those responses you required, those hundreds of interactions, you know, maybe that goes back to the bonding you were talking about, how bonding happens first and then attachment, because what happens often in those first 6 months is sleep is so funky, you know, and that those interactions happen. I think those responses to like irregular sleep cycles, those are parts of those building blocks of then when you see the product of your child's attachment at 6 to 7 months, you know, really that starts to show.
And I think, you know, Dr. Chambers, you can talk more about this, but I think that's why, like when we're talking about adoption and trying to help families form these secure attachments with their kids, nutrition and sleep is vital. So can you talk a little bit about that?
Yeah, I mean, I feel like, I always tell people I feel like sleep is this like magic secret weapon. And I think it does go back to those newborn periods when you're trying to build initial attachment. Sleep is so connected, and feeling safety when you sleep and safety as you wake up, and safety as you go to sleep is so foundational. And nutrition, that's all a baby's doing is eating and sleeping. And that's how we are co-regulating them, or regulating them, fully regulating them. And so when a child comes home, where they sleep, how they sleep, who sleeps near them, who feeds them, is just as crucial as those newborn periods. And so that's why sometimes, you know, we will often recommend what we call close sleeping. It doesn't have to be co-sleeping in the same bed, but close sleeping so that we can take advantage of that time that is actually rather easy to parent. Because, I mean, there's nothing easier than sleeping and parenting. Do you know what I mean?
Yes.
And so you can really maximize and get a lot of work done from the comfort of your own bed, you know, with that child nearby, and waking up and seeing your face right there, and going to sleep not thinking they're going to get up and leave me in the middle of the night. Because most of our children have never slept in a room by themselves. And a lot of our kids have come from orphanage or other countries where their kids were that, you know, sleeping in another room individually by yourself is not cultural.
In most places in the world is not.
Most places in the world is not. Yeah, exactly. It's a very American tradition. So, and a lot of times the transitions that go the best are the ones where the parents are open to close sleeping, and it doesn't have to last forever. Again, it's a stage of attachment, and it's such a transition for a lot of parents to think about. We're kind of trained to be like, okay, our kid needs to sleep through the night at this age, right? But it's not about sleeping through the night. It's about building the attachment and laying that strong foundation. And you're never going to have this chance again. This is a really important and vital part of your adoption process, is building that attachment solid from the very beginning.
And we've told parents so many times, I know, over the years, that we promise them, like, we promise you that we will always be able to help you get that child out of your bed or out of your room, because that is such a fear. Again, like, American culture just values like independence so much, and we will get there, but the timing's got to be right.
And that independence will be stronger. If that attachment is stronger, because attachment is the basis. I mean, you have to have attachment in order to do three things: to trust other people, to self-regulate, which would be sleeping by yourself, and to have self-reliance, again, sleeping by yourself. You really have to have that base in order to have that independence later and have that secure independence. So it's kind of counterintuitive. Make them completely dependent so that they can become independent, but it's really just bringing them back down to that newborn stage and going through those phases again for them, and reparenting them through those phases.
And I was just thinking, another thing that we really recommend to help lay the foundation for secure attachment is in regards to nutrition. So many of the kiddos not only have, of course, like these breaks in attachment, but they have food insecurity needs, times where they've experienced like deprivation or haven't been able to eat enough. And so that's one of the common problems that we'll often see. And so our recommendation is generally counterintuitive, and that is access to food. Don't set too many rigid rules around food intake, because again, the gut is so connected to the mind, and so it's really important for a child to know that, again, like as a baby, when a baby wakes up and cries, a newborn or an infant, parents don't generally say no. You can't eat right now. You feed the baby, or you give the baby what it needs. The same with our kids who've experienced, trauma and attachment disruptions, is you feed them, like you allow access to food. So, and that's something that we can help with too, how to set that up in a way that is best for your family, but also going to create the opportunity for attachment and using that.
Which goes back to kind of what we talked about in an earlier podcast of nurture versus structure. Is that you're not just giving them whatever they want, you're giving them how much ever they want, and you choose the what, and they're choosing the how much. So this is when we often say, just get the processed foods out of the house, get the sugary foods out of the house, so that that's not have to be a constant battle. And then that way the child feels like there are more yeses with food, but you're still requiring good nutrition.
Food should almost always be a yes. You should always set it up so that you can give as many yeses as possible around food.
Because with our children, we're having to recreate that attachment cycle hundreds and thousands of times, because we're not starting from scratch. We're not starting with a fresh slate. We're starting with disordered attachment. So like you mentioned, the attachment cycle when it goes as natural. What can you explain the attachment cycle when it doesn't go correctly, when there's trauma involved?
Oh, that's a big one.
Well, kind of like when the baby
there's
cries.
like an interruption in the cycle.
Here, you take it. You directed it.
Yeah.
So when there's trauma involved, the child cries out, and there's, they have a need, whether that need is like, I need my diaper changed, or I'm hungry, or I've just woken up and I want to reconnect, So they cry out and nobody shows up. And then maybe they cry a little bit louder and nobody shows up. And then they get a little bit louder and nobody shows up. And then maybe eventually they settle down, and just kind of go back to sleep. And then this happens again, over and over and over again. And then the messaging is, when I have a need, nobody shows up. And so that shifts their ability to create safety in relationship with others. And that, trickles down to their attachment of they don't create that secure base. They now have an insecure base because there is not, and I have no control over getting my needs met because I'm a baby. I'm totally vulnerable. And there is no person showing up to meet those needs when I express them.
Or when I express my needs, someone shows up and they're scary.
Yeah. Yes. Yep. I cried out for a need and I was yelled at, or I was whatever traumatic response is provided. And so the messaging is when I have a need, there is not a safe person available to meet that need for me. So I don't know how that is interpreted. It's probably different, but like I am alone. I am unsafe. I am uncared for. I am unwanted. All of these things that we see show up, just deep level pain in the adoptee population. And it starts with those very early experiences that for our kids that are in care long time, that it piles on top of itself for years on top of years on top of years, and they create self-reliance, and so that ability to have vulnerable, trusting relationships with others is so damaged, which is why when we talk about like going through these stages of basically you're taking your 4-year-old that just came home and you're re-going through these newborn stages with them. You're sleeping close with them because you have to train the brain, you have to create neural pathways of trust and dependence. And the only way you do that is through connection and action, through these repeated experiences. We have, using this example of a 4-year-old, you have 4 years of inconsistent, unsafe responses that we are now having to go back and through adoption and through family create healthy responses. And that takes so much time. It's that use of attachment-informed, trauma-sensitive parenting, which we talk about in another podcast over and over and over again, to go from an insecure attachment to hopefully eventually an earned secure attachment.
I think it's interesting you mentioned about how that caregiver shows up will impact the messaging that the child gets. Because if a child, say, is experiencing violence or abuse or whether it's physical abuse or verbal abuse, then they tend to get that message that that they're not liked, they're not loved. Versus a child who's completely neglected, and nobody comes, then they begin to feel like I don't exist.
Yeah, I'm alone. I don't exist. Yeah.
Yeah. So kind of looking at a child's background, you're able to better see how we can intervene and how we can make that attachment go from insecure to earned secure.
Yeah. And that's, I think, one of the things we offer parents at the clinic is we can look at a child's history. We have pre-adopts available where Dr. Chambers can look at all the information we have on file for a kiddo that the country is able to provide. And we can say, it sounds like this environment may have created these types of patterns for your kid. So your parenting responses need to look like this. And that's, one of the things that our team is like trained and equipped to do, where you really have not just attachment focused parenting, but like child specific attachment focused parenting.
Yeah. One question we get often is, how do I know if my child's fully attached, or how do I, judge or meter how our attachment's going? Do y'all want to talk a little bit about that?
I think one thing I always tell families is like attachment is for a lifetime. Like you're not gonna just like really attachment parent so well for 6 months and then like you've checked the box and you're done. It's attachment occurs through every instance and interaction with your child. Like it is something that you are, as they grow and hit a new developmental stage or go through something hard, that's a new opportunity to establish and reaffirm your child's attachment with you. So, which can sound daunting, but really it's just like you're going to have so many opportunities to create attachment. It's something that it's relational. It's something that is continuous.
And if you build that foundation at the beginning, then you have a lot more opportunity to mess it up.
Right.
Because we are human, we are going to mess things up. But if you take that time in the very beginning to build like a really good foundation, then there's lots of room to make withdrawals from that, Another way I tell parents that they can kind of look at attachment and how that's going is, what is your attachment like to your child? You know, because if a parent doesn't feel connected and attached to their child, then likely that's probably a mirror image to what that child's feeling. That's not always, you know, a perfect recipe, but it's a pretty good indicator about how things are going.
Because, I mean, it is. We kind of read a lot when we're preparing for to foster or to adopt a child. We read about attachment a lot, and we're much more prepared about how the child might respond than how we might respond. And I think every one of us as caregivers, parents of adopted or foster children, that's one of the shocks. You know, I didn't think I would respond that way, or I didn't think my spouse would respond that way, and just feeling sometimes guilt about not being fully attached to a child. It is a little easier to attach to the younger the child is, because part of attachment is just taking care of someone else's needs. As you take care of someone else's needs and someone else is very dependent on you, it builds attachment naturally. That doesn't mean that you're going to be fully attached to every little baby, but it builds in some ease with attachment. The older the child is, sometimes the harder it can be, just because that dependency isn't there. But your attachment to that child is not a guarantee, and it's not a failure of who you are and your
worth as a parent.
Your worth as a parent. Yeah, it just oftentimes takes time, much like meeting your spouse, and you don't get in, you know, there is love at first sight, but for the majority of us, there's not, you know, and you meet and you build that relationship, and then the love grows. And I think we think that it's different with parenting, but often it's not.
And I also tell parents too, like, attachment for them and for the child is not a steady uphill climb. You know, it's going to be 5 steps forward, 10 steps back, 3 steps forward, 2 steps back, you know, and you've got to think in terms of months and years, not days and weeks, you know, but when you're looking at the child, you're looking at your relationship, you know, in 3 months from now, in 6 months from now, and 1 year from now, you should feel a little bit more attached. And if not, that's okay too, but get help from professionals who can help you build that, you know.
Yeah, we love to support people a lot in the beginning, because those are the building blocks that you're laying down for attachment. It's not the end, the be-all end-all goal, as far it's not the end, because there's so much building that's going to go. But it is nice to have those foundation blocks laid at least solidly and correctly in those first 6 months home.
I think there are some behaviors we look for too, like a shift, or maybe a behavior is present that is a sign of an insecure attachment. And then after some time, we should see a change in that. Like, one that comes to mind is indiscriminate affection. You know, kids who will run up to anybody. You take them to the grocery store and they'll run up to a stranger in Target and give them a hug and ask to go home with them. Or kids who maybe fall down and get hurt and don't go to you to be cared for. And as you work through attachment, you should see some of those things change, where your child is able to identify you as their person, that they receive affection and care from.
Right. Kids who are superficially charming. You know, kids who, you know, put on a little song and dance because they're trying to earn, you know, positive interactions from you.
Yeah,
that can be a sign.
Like, positive interaction feels like love, because maybe in their setting before, that's how they were favored, by being a good kid or a cute kid or a funny kid. And so they'll replicate that at home.
And sometimes that will go back to, you know, what we talked about in an earlier episode of like trauma bonding, you know, where a kid is not really attachment. It's like a child like safety seeking, you know, trying to get someone to like them, to care for their needs versus true attachment.
I think that's so hard sometimes for us as parents to know, well, isn't that just my child's personality? They're just extroverted. They're just a people person. And so it's hard sometimes to pull a child back. And I think that's, you know, we always say it could be part of their personality, but to be on the safe side, I think we still need to, these first 6 months, cocoon, which would be kind of stay home, make their world very small, make sure that you're the only ones doing the caregiving, the primary caregiving, such as sleeping, getting them to sleep, feeding them, diaper changes, all of those things. And then later we'll be able to see, okay, well, was that part of their personality or not? But just to give them that, make their world really, really small in the beginning is so important to build those solid blocks of foundation of attachment. Mm-hmm. Sometimes also, I think behaviors or signals that a child is not, the attachment is not secure also. Maybe not having remorse or, not coming to the parent and seeking affection. Yeah. That would be another indicator.
Not proximity seeking, so that's something that we look for here, like if the parents are in a room talking to one of our specialists and the child is maybe outside of the room playing in the playhouse, like as a professional, I'm sitting there and like counting how many times is the kiddo coming in and checking in with the parents, coming in and showing the parents something, because that would be a sign of positive versus, them being outside of the room in a strange place with strange people and not checking in for an hour. That would be a sign that we care about.
And thinking about all these behaviors makes me think about like how important, when we talk about attachment informed providers, because, or even adoption informed providers, because if you take a child with adoption in their history, and we talk about lack of remorse, and we talk about inability to provide or receive affection, or maybe even aggression when affection is presented, which we hear these things and we think these are all signs of insecure attachment, but an untrained professional or just an unfamiliar professional with our kids are going to say that kid has reactive attachment disorder. And that is such a heavy and potentially damaging label for a child, and often inaccurately diagnosed.
Right. Yeah, I would say it's less than 5% of our kids are going to have a true diagnosis of reactive attachment disorder.
And I think that's pretty generous, Like I'm thinking, collectively we've probably seen thousands of patients over the years. And I remember, you speak to this too, I remember looking at that as a real diagnosis maybe 3 times.
Yeah, I definitely can't say. I can probably name those patients.
Yeah,
still.
Right. Right. Yeah.
But there still is, attachment insecurities.
Right.
And there's attachment damage that's been done.
Yeah.
But when you do label a reactive attachment disorder, it does definitely feel hopeless.
Right.
And most of our kids have a lot of hope,
Right.
to build that attachment.
Right.
With support.
Right. And I think any adoptee, anybody, maybe not even adoptees, but anyone who have experienced relational disruptions are going to have some attachment insecurities.
Yeah.
That's a given, but it's how much. It's all along a spectrum. And so I think that's what parents have to remember is, one, attachment is not a one and done. It's lifelong. And where do we fall on that spectrum, and parent accordingly.
Yeah, it makes me think too about like the work we do here at the clinic and making sure that if you are an adoptive parent seeking therapy for your child, making sure that you have a provider that understands adoption and attachment and trauma really well, because a skilled provider working with this population, knowing how fragile attachment is, will incorporate parent and child into the session. You will not have a young child doing play therapy without the parent present, because that child needs to establish attachment with their safe caregiver, their safe parent, before they establish that attachment and safety with a therapist.
Right. And even outside of like counselors, other professionals like OTs, PTs, speech therapists, that like all of those people who have contact, anyone who has contact with their child needs to be able to look at their needs through an attachment focused lens. And they need to be taking into account what's going to be the most healing and beneficial for that child while taking attachment into account. So I think that's really important. Specialists who refuse to make accommodations for, attachment needs that child has may not be the right fit.
Yeah. And if you're a parent listening to this and you're thinking like, oh shoot, my child's already in speech, how do I help make their experience more attachment friendly? Reach out to us. Like, we can set up parent coaching. We can provide you with opportunities to put some boundaries or suggestions in place with your speech therapist. If you have that dynamic where they're willing to work with you, where you can say, I would like to sit in on sessions and I would like to be, anytime there's eye contact, I would like to do that with my child.
And even, something that we love to do as a clinic is help to train other professionals. So whether that is, if your speech therapist or therapist is open to consultation with us, we would love to do that. Or like just through trainings for, specialists at one time. Like we would love to be able to help educate the larger community about the needs of our kids, because there's not enough of us who are really trained in, working with our population, our really unique population, who has a lot of times some counterintuitive needs from the general population that specialists work with. We would love to do that and help in that way.
And it can feel like we're working on borrowed time too, especially with our older adoptees. It feels like we have such a small window to build secure attachment, and there's just such a small margin for like missing it with those older kiddos, so like just really utilizing and taking advantage of true attachment informed providers. It's important.
I think one thing that that we do that sometimes feels counterintuitive is when a child's newly in a home, newly in that foster home, or newly adopted, is really minimizing the amount of therapy that they're getting in that beginning 6 months, especially when, like, if a child's coming through, say, international adoption, there's a lot of medical specialists they need to go to, lab work that need to be done. And even with foster care, there's such a change, and there's so much feelings of insecurity that the primary focus those first 6 months really is attachment. And you can, and making sure the child feels safe, so which we call felt safety. So we know the child's safe, but do they actually feel safe? So, and then that way, like our therapists will see our parents and see the child, but then recommend things that the parent can do to help during those 3 to 6 months to facilitate therapy, rather than carting the kid to this therapist or this therapist's office, and that therapist taking them in the back and working with them in certain ways. So that's another way to build those foundational skills, so that attachment is built prior to other things, because really a child can't even meet their own intellectual potential until attachment is fully established.
Nothing else matters
until
attachment is established.
Yeah.
We could talk about, I don't know that we've talked about, like, I mean, I know we've mentioned it some, but like rewiring the brain, like I was one of the TBRI people, it may have been Karen Purvis, who talked about, like, even though we're not in the adoption scenario, even though you're not your child's biological parent, you have biological impact, and that you can rewire their brain through, these safe, responsive, nurturing, consistent caregiving that you're giving to your child, that you are developing in place of traumatically impacted neural pathways. Now we have safety, neural pathways impacted by safety and connection, and that is a biological impact. And there's a lot of, power that falls in the hands of our caregivers, that they can really impact how our children experience the world. We can, that like concept of felt safety, we are able to help them create that by how we parent them.
Yeah, that's a neat thought about the biological impact. And then think, just to really explain when we talk about changing neural pathways, maybe we can touch a little bit about what that means, because we're born with all of our brain cells, are already there. But as an infant, your body is creating neurological pathways that are created through experiences, and they get more and more complex as the months and months go on, and you build these connections through these neurological pathways, and that determines how you see the world. And so many of our kids have neurological pathways built for a trauma response, and so that's what we're changing. When we talk about neurological pathways changing, that's what we're talking about, is reworking. And again, we're not starting with a clean slate. We're starting with abnormal pathways. And so that's why it feels like it's taking forever, and it is, in the middle of the night when the kid wakes up and is really upset, and you're like exhausted, and I have done this 100 times, they know they're safe. What is the problem here? And you just have to remind yourself, I am changing this child's brain biologically. It's going to take thousands of repetitions to actually change this child's brain. And that's what our aim is, not the behavior. It's where the behavior is coming from, that neurological basis of where that behavior is coming from, kind of building connection and thinking about connection over consequences.
And as parents, we're changing ourselves along the way.
Oh,
you
yes,
know?
we
like
are.
We're creating patience and presence where maybe there was like frustration and disconnect. So as our
yes.
child's developing healthier neural pathways, so are we. There's so much beauty that happens there and like the co-attachment that's taking place.
Yeah.
It's so hard though. It feels so difficult in the moment, but there's such beautiful interaction and just such beauty that comes from that repetition and consistency and showing up in the hard.
I liked what you said about us changing. Yeah, and sometimes that's hard. That's
Yeah,
hard. That's
so
deep
hard.
work we're asking parents to do.
Yes.
And that's why we're just happy to walk alongside people through either therapy or parent coaching, because it's hard work
It is hard.
that we're required to do
Yeah.
parenting these.
Yeah.
And I think that I just want parents to hear that you don't have to be perfect. Like, you're going to mess up. You're going to respond in a way that is not connected or is not attachment and trauma informed. But there's room for that, you know, there's room for that. And I think even just as important, if not more important than your initial response, is repair. So as a parent, being willing to go to that child and based on that child's developmental level, like apologizing, you know, and then reconnecting and then moving forward and moving on. That is just as important, if not more important than, you know, having your initial response be perfect.
Because how else are they going to learn?
Right.
What do they do when they mess up?
Right.
They've got to learn it from you when you
Right.
mess up. So it's a strong presence that you're offering them, a strong
Yeah.
example of what
Right.
to do when you mess up.
Yeah. Right.
So again, I feel like we really, I feel like we did. We just scratched the surface.
Yeah.
There's so many more little
many.
rabbit trails we could take to get down deeper, and maybe we'll have to do that in some other podcasts.
Yeah.
It's one of my favorite topics to talk about, so we could break it down a lot.
It is, definitely. So thank you for joining us. And again, if you have more questions that we haven't answered on the podcast, you're welcome to reach out to us, and we're happy to hold your hand through this process. Thank you.
Thank you for joining the Adoption and Foster Care Clinic for another episode of Beneath the Branches, a podcast for adoptive, foster, and kinship care families. We are deeply grateful to our sponsor, Show Hope, for their generous support and their continued work to break down barriers to adoption and support families every step of the way. Until next time, may you feel covered, connected, and never alone beneath the branches.